and welcome everyone to Women's Health Tech Wednesdays. I am your host, Nina Joshi. I'd like to formally introduce Angela. Thanks so much for being here.
Thanks for having me. Always great to be with the HITLAB team.
I love it. Well, maybe before we kind of jump into all of the questions that I have for you, I'd love to pick your brain. Would love if maybe you could kind of give us an intro, tell us a little bit more about yourself and your journey.
Sure, happy to. So because this is a Women's Health Wednesday, I'll start with the stuff that really matters. I'm the mom of three awesome kids. One's a high school teacher and one works in medical communications, and the other is 11 and giving me a run for my money. Although she's brilliant. And I'm married to an awesome guy who's a firefighter, and I have a dog named Benny for Beignet because he comes from Louisiana. My journey in this space really started in 2001. So while I was in industry working for a payer and working for one of the big distributors and working for a big tech firm, I hadn't really found my vocation or my calling. And then in 2001, one of my younger siblings, I'm the oldest of six kids, he was serving as a chaplain in the U.S. Army on the demarcation between North and South Korea, and 21 years old, healthiest of all of us, and he got out of a pool and he died. No sign or symptom.
Wow.
And the result of that, and this is we're 20 plus years out from that event in my life. So it's really shaped everything, but I can now talk about it almost as a gift and not with the pain of the experience. Because of that experience, our family got engaged in a clinical research study, and that study found the heart condition in our family. It's called long QT. Often is the reason you hear about a kid passing out on a basketball court, or even can be the cause of SIDS in some babies. And they found the gene in our family, that clinical research trial. And I'm from a very big family. And so that trial has gone on to save many lives in my own family. And I realized this is what I want to be doing. I don't think people understand the value of clinical research. And I'm going to go make a difference there. And so that really began my journey in healthcare in the R&D side.
Wow. I mean, what a story. I could definitely see how there's just so much kind of passion. And I think having that personal relationship to it, I can only imagine how that just makes you better able to have that lens to serve kind of in your role right now.
Yeah, it's I think many of us in healthcare, we do come from a place of true vocation. Like, we're in this work for a reason, because someone we love has a health condition, because we know that healthcare can cause impact on social issues, or just because we find it interesting and exciting. But I think that's the thing that we have to keep at the front of our minds at all times, right? Is what anchors us to the work. Why do we do the work we do?
Absolutely. But I think that's just a great just word of like a nugget of wisdom, I think, in general. So I absolutely agree with you. Kind of speaking a little bit to the research side, I know that kind of in your work, as a speaker, you really talk about the importance of inclusive research. So would love if, we could maybe start with that. Would love if you could provide any insights on how inclusive research can address these root causes of really challenging social issues, and how we can continue to really use inclusivity as like a blueprint for designing research.
Yeah, thanks for asking about that. I mean, because of the Fedora Act, we're all of a sudden, again, talking about diversity and inclusion in clinical trials, which, ethically and morally, it's my opinion that this is part and parcel of what we do. We're here to serve everyone. We're here to discover medicines that save lives, and that means including everyone in the process. And it's a real shame that we have to have regulations to tell us to do the right thing as far as designing our studies and who we should recruit. But I think it's bigger than that. So you sort of mentioned that I believe research can impact the social causes that we care about. And that is something that I don't think a lot of people have their arms around. But I'll tell you this story. I grew up very, very poor, outhouse poor, had an outhouse till I was 13. And my dad sort of built our house from the ground up, and we were part of government health programs. And, so things like the dental care that I got as a child, those things were provided to me as a social service. You know, a lot of our meals came from free school and free school lunch, free school breakfast programs. And we, in many ways, were disenfranchised, you know, out in a rural setting from having access to some of the types of healthcare that now, as a very privileged person who is health literate, who works in this industry, you know, I have access to. And if I think about that experience and what it's done for my health outcomes as an adult, whether it is how my dental care has affected my cardiovascular health, whether it is how my eating habits were set up for life based on the types of food and nutrition I had access to. That's one part of the story. But the other part of the story is we're all just that, you know, you hear it, but it's truer than you think, especially in today's day and age. We're all just 1 or 2 paychecks away from being homeless. Mm-hmm. And in addition to the you know, economic challenges that drive homelessness, the other biggest causes are untreated mental illness and untreated substance abuse. And so I always like to say, if I told you that participating in a research study on bipolar disorder, as a healthy volunteer for, you know, as a control arm for depression, as someone who wants to help contribute surveys to research happening around alcohol use disorder, which is really prevalent even in our professional communities. If you'd participated in that, you could stop someone from becoming homeless. That's the kind of impact that I want to make. And that's the kind of impact that clinical research actually does make on the social causes we care about. So if you really, truly care about homelessness, or you care about, you know, childhood nutrition and poverty, or you care about equity and inclusion, then you should be participating in research, because participating in research is having all of these downstream effects in addition to helping us find treatments and cures for things. But for many years, we have been doing research on perfect patients, white males between the ages of 18 and 65. And that is disenfranchising an entire group of people. And so we're finally hitting a point where, whether it was the pandemic, whether it is the fact that data, machine learning, artificial intelligence, predictive analytics, whether all of these things are starting to come together to help us do a better job at bringing research to patients where they are, instead of saying, let's pick this perfect group of subjects, let's do some research, let's prove the drug works for them, and then we're just going to do our best to make sure that these treatments and cures work for others. It's unacceptable. We should be far past that at this point. And I'm seeing a lot of great signals that we're going to do better and do more, but we've got a lot of growing pains ahead of us.
Absolutely. I mean, wow. Can I just say that was such a beautiful reframing, I think, for me, when we think about clinical research really as kind of the engine for driving social change. I think that I just haven't even thought of it that way. I think that's absolutely incredible. There were a couple of things that you touched on that I would love to dig into. I think the first that you had mentioned is really around health and data literacy and kind of the importance of that. Would love if you could share a little bit more on some of maybe the barriers that you're seeing on that front, and if there's anything that you're kind of thinking through on how to kind of alleviate some of that.
Yeah, you know, so first of all, I'll start with like the happy, hopeful part, which is in health literacy, I think we've got it wrong for many years. It's still true that 4 out of 5 adults do not have the health literacy they need to make a decision for their health, for themselves or a loved one. That's devastating, especially when you think about where we stand with chronic conditions in an aging population and the onslaught of things like Alzheimer's, right? But in digital health and data, we have an opportunity to get it right. And I think it takes both. So we're in a new place where not only health literacy matters, but data and digital literacy matters. And the two things can feed one another in a really productive way. So when I say we missed the boat on health literacy, it's not just that the statistics are very poor. It's that we, as a healthcare industry at large, whether you are in a big pharma, a small biotech, whether you are at a clinical research site, whether you are in a hospital or healthcare system or a technology vendor, most of us have not been planting the seeds to receive the fruit on the trees that we hope for. So when we ask someone to become health literate, we usually ask them to become health literate at the worst possible time of their life. We are saying to you, hey, you've got stage 4 melanoma, and nothing that we have is going to work for you. And so we'd really like you to participate in this clinical trial. So you're receiving news about a devastating health diagnosis. And at the same time, you've got to somehow figure out, like, what is a clinical trial? Why would I participate? What is this thing called a biomarker? How does my genetics have to do with these things? You know, should I be doing nutrition stuff too? Like, we are asking people this huge lift when we could be teaching health literacy as early as elementary school, first of all. So that's the first place we sort of missed the boat. We could be teaching it as part of our corporate social responsibility programs, right? We could be bringing health literacy home there. I mean, employers foot the bill for most of our healthcare, at least in the United States. And so they have a ton of incentive to try and improve our health literacy so we make better health decisions. And of course, you know, and I have to do the disclaimer, I don't say this representing BMS when I say this, but as any big pharma person working in big pharma, I think we have a real responsibility to recognize that if we'd like people to participate in our clinical trials, then we ought to be doing some disease state education and some clinical trial awareness and education and investing there. It's like putting money in the 401k and being able to harvest the investment later, and you're doing it to create a greater good. Now we're at this place where digital and data is you know, it's being taught everywhere. In a couple of weeks, I'm putting out an AI workbook for kids in grades 4 through 8 on generative AI. Why am I doing that? Because I have an 11-year-old who's already trying to figure out, how does she use ChatGPT to get her book report done, right? Because I parented through the YouTube generation, the social media influencer generation, and I had a time when I had a child that didn't even have a cell phone or know what a cell phone was, right? So right now is our opportunity to be teaching people, starting with our kids, but all the way to now, how and why data is critically important. They've got to understand that AI is nothing without data, and data truly is the lifeblood of much of what we do in this world, in healthcare and beyond. And so getting a true understanding of how we're generating data, where it's coming from, and the potential for using it is super important. And once you have these amazing tools like ChatGPT, you can provide people health literacy and education in ways that are approachable. So it really is a virtuous circle if we're willing to approach it in such a way that we bring people along and we don't just expect people to figure it out on their own.
Absolutely. And I love 100%. And I love that you're really describing this kind of virtuous cycle, this positive feedback loop, where you really kind of are setting a very sustainable system up. Two things that I want to talk, like just learn more from you. I know the first is all about the data and the AI, and I definitely want to cover that. And also, if you are sharing that workbook, would love a copy. I personally would love some education on the Gen AI stuff. But wanted to touch on a little bit something you had mentioned earlier, really around kind of normalizing clinical research and kind of starting to have those conversations and kind of making that more aware, like you were saying, upstream. Kind of for you, when you think about what it looks like from kind of the clinical trial or clinical research process, what are some of the barriers that you're kind of seeing, or some of the misconceptions that kind of currently exist around what it means to kind of be a part of a clinical trial? And are there any ways that you can see it being addressed? And maybe, you know, AI and tech is one of them.
Yeah, I hope I'm not doing too much of a repeat of something I shared on a previous HITLAB session at one of the symposiums, but I do think it's the most approachable example of why we need to be thinking about clinical research as a care option and how we sort of advance that. And it's it's the Amazon shoe shopping concept. So both of us can we've got an event coming up. Maybe it's a special date with our partner, or, our kid's wedding. I have my oldest just got engaged, so I'm anxiously looking forward to that wedding happening. And we can go on Amazon and we can search for a pair of shoes, but we don't just search. We search for blue shoes in size 7, and we want them to be a 2-inch heel, and we want them to be from this particular maker, and we want them to come to us at our home in 2 days. When it comes to clinical research, it has been an option that's been off the menu largely. It's sort of like on the secret menu. Like if you go to a speakeasy and you have the secret password, you can get in and get the special, signature item off of their tasting menu. Well, it's the same with clinical research. Like you either know or you don't know. And that's really sad, right? Because what we should be able to do is if I go onto Google or, and any other search engine, and I type in that I have a migraine, the treatment options that should come up for me in this recommender system, it should be pharmaceutical prescription options. It should be things like diet, exercise, and other lifestyle changes that might, might be tests and things that I need to be getting done to rule out an allergen that causes migraine. It should be suggesting over-the-counter treatments for me too. And then it should also suggest clinical research studies. But we don't do that. And we don't do that. And the biggest objection I still hear about clinical research as a care option is clinical research is different than clinical care. And we cannot be promising people that clinical research is going to deliver results for them. Well, guess what? The Excedrin didn't deliver results for my migraine either. And it's an approved treatment out on the over-the-counter market. And in addition to that, the other objection that we hear is, well, clinical research has to be done in a controlled setting and healthcare is different. Well, that's all just noise in my very obviously not so humble opinion about this. But the fact of the matter is that how are we supposed to know that an option exists if it's never presented to us? And we are now being forced to really start to look at clinical research as a care option, because now we are starting to realize we can't do our studies where we need to do our studies with the communities we need to do our studies with without going out into the care settings that already exist. And a lot of people, this has been a trend, a topic for more than 10 years. And we're still just starting to get there. And the pandemic sort of supercharged our willingness to look at different locations to conduct our research. But unfortunately, we've sort of slipped backwards a little bit too. And we're now back into that complacent zone and not pushing it forward. So I went long there. So I don't know if I answered your question, Nina.
You 100% did. And I think you really touched on, I think, at least for me, one of the things that I kind of always hear in relation to clinical trials is it's just shrouded in mystery. And it's exactly to your point that it's just not something that's really talked about as a care option kind of early on. So there, it's kind of because there's so much secrecy, there's so much secretness around it, it does make it a little bit scary, or there can be kind of that gap to actually consider it as a valid option. So I think that makes a lot of sense. Wanted to kind of talk to you a little bit about kind of the data piece of it. I know that you are a data ethics evangelist, and I can just imagine with AI and a lot of the advancements that have been made. I'm so curious to see, how data ethics is kind of continuing to evolve as more and more technology is really entering the space that is, being a part of clinical research.
Yeah, I have a good friend and mentor, and one of the most profound things he ever sort of woke up in my mind was this concept of how many times a day we click an I accept button on a set of terms and conditions. So how often do we just, without thinking, because we want that app on our phone, say yes? Nobody reads the information there. We could be giving our firstborn child away and saying yes, and we just don't realize that there was a really great creepy Black Mirror episode about this not too long ago, for those of you who are sci-fi fans. But we say, sure, I will exchange my data for this thing. And this thing is often something trivial, like my husband's beloved solitaire app. Right? But sometimes we're exchanging our data for something so much more important, but we haven't been taught to differentiate between the two. Number one. Number two, data has been the wild, wild west for many years. And so, yes, there's such a thing as HIPAA. And yes, we have good intentions with patient data, but there have been times where patient data, anonymized, de-identified, which, by the way, for those of you who don't know, has been debunked. Like most de-identified data can be re-identified within just a couple of hops. But there have been examples of, de-identified aggregated healthcare data from patients being sold back to companies. So maybe your MRI data is being sold back and you just shelled out $2,000 of a copay to get that MRI, but your data from that is being sold and someone's profiting from it. And without getting into the good and the bad of all that, because look, there's a lot of, black and white and gray in between how healthcare data is used in exchange. It's not just our healthcare data anymore, right? It's our GPS data from our cell phones. It's the real world data. When people hear real world data, what are they talking about? Well, it's your purchasing, patterns. It's all sorts of things. And data can be used for good and it can be used for bad. And one of the things that we need to keep in the back of our minds is, as we move forward with data into this sort of brave new world of artificial intelligence, especially in the generative AI world, we have to understand that there are unintended consequences of the way that we're doing things. And one of those unintended consequences is setting up our systems for bias. And there are a lot of great things in the artificial intelligence landscape that can help us debias our biased systems. And so technology can help us with technology, and that's great.
Totally.
But it starts with us all having a human understanding of what we're actually giving up. Understanding, when you hear the phrase like data is the new oil, I hate that one, because that is actually such an understatement for how important data is. And our healthcare data, I mean, some of you in this community probably, remember the amazing healthcare advocate, Casey Quinlan, who had her medical record tattooed on her as a QR code because she couldn't keep her medical data all in one place, and she had to bring it all together for herself so she could get the care that she deserved. So if we come to a point where patient advocates are tattooing a QR code of their health record on their bodies, that should give us a wake-up call for how important that data can be. It's a life or death thing to understand how we're using the data and how that data can work for good or for bad. We all have a responsibility to get a true understanding around data and create our own points of view around the ethics that we're willing to stand behind, and the trade-offs that we're willing to make. Because when we talk about data ethics, the trade-off, to get an app might be a little thing. Maybe you're allowing them to market to you, and maybe that's not a big deal to you. But when you're agreeing to let your data be used for a clinical research study, you have to understand what you're consenting to. And sometimes you absolutely want to give that data away because your data could equal the cure for somebody you love down the road.
Absolutely. I love that. I think I was even just thinking to myself, as just kind of a patient, as one person, what can I do? But I think we had just talked about this really data literacy, and exactly to your point of knowing exactly what you are saying yes to and what that means for you, and setting your own kind of lines in the stands for what you are comfortable with, I think sounds like such a great place to start.
I'm glad you think so. I mean, I think it is all in the little tiny actions. They all add up for us, right?
Absolutely. And I kind of wanted to ask, I think, at least for me, I've been hearing a lot of applications for AI, specifically in care delivery, decision support for physicians, things like that. Are there any applications that you're seeing for AI kind of in the clinical research side of the house that you think are really incredible or something interesting?
Some of the things that I think are most exciting are the AI platforms that are starting to help us move from this sort of world of dashboards, Excel spreadsheets, dashboards, etc. We are overwhelmed with data, and we are really good at looking at a dashboard, but we don't take actionable steps against our data because the data is not organized for us to do things that are both predictive and prescriptive. And so
Mhm.
there are platforms out there that are starting to really help us leverage the power of artificial intelligence to look at the signals, and then we can't divorce the technology from the human aspect in anything that we do. And so sometimes when I'm looking at a signal that says, oh, this site isn't recruiting for the trial, the data is not actually going to tell me why they're not recruiting. They're just going to tell me they're not recruiting. But then it's my job to say something's wrong here, go lift up the hood and understand, like, oh, the site's not recruiting because they have 2 study coordinators. One's out from maternity leave and the other is, assigned to another higher priority project. Like, we need to get to a point where before it's a problem, before they're not recruiting for the trial, we have a signal that tells us that we can get at the root cause and then intervene when it makes the most sense. So I think platforms like that, platforms that are starting to create a feedback loop for us that help us understand how that data feeds what we could be doing, say, even at the protocol design phase. So I could throw a number of different partners out there that I'm really excited about, but the list would go on and on. I'll just close this topic by saying, the potential for large language models in drug discovery and helping us to find connections that we never saw before in the science, we are at an incredibly exciting time for drug discovery. And it's one of those things that you can hold up and say, like, why is it worth mucking through all of this right now? That's the reason why, because we are going to discover things that previously would have taken us 10, 20, 30 years to discover previously without artificial intelligence.
Absolutely. I think that's incredible. And I realized that we are 1 minute away, which is crazy. I think we were just, oh, what a conversation. Time flew. I think I would love to end. I think I'm just going back to one of the questions and conversations that we were having earlier. And you were mentioning, clinical research being that drive for change and being involved in studies, even though you necessarily are not kind of in the category of the disease state that it's looking for someone, like myself, maybe others on the call that are really inspired by that. What are places for us to start? Like, how can we go and find these types of clinical research studies that we can be a part of that can have, impact?
Yeah, I always like to say that observational studies are the gateway drug of clinical trial participation, because if you get into an observational study, so that's signing up for a registry. So if you or a loved one has a health condition and joining a registry where they're going to send you an occasional survey and they're going to track sort of what's going on with you. They're going to ask you some questions because they're going to be able to infer certain things about maybe the quality of life for your condition. Or go to a local university that does clinical research. They're always doing observational studies. And sometimes there's studies that you can really learn something interesting about. The other place to sort of dip your toe in is with your wearables. I wear an Oura ring. I think a lot of you probably wear Oura rings, or you wear, Apple Watches. And Oura recently released some information about caffeine and its impact on your sleep. And then I myself could go in and try and track my caffeine for a period of days to do my own personalized study. So just keep in mind that when you start to participate in observational research, not only are you helping others, but you're also likely learning new things about yourself. And then once you do that, then you have an understanding, how does this work? What is this going to mean? And then you can start looking for interventional studies that might allow you to have more time. But at the end of the day, my call to action is the same as it was on HITLAB Symposium. Just participate. Just get in there and try it out. The benefit to you and to the world is exponential.
That is amazing. And what a beautiful place to end. I think that's like a mic drop moment. Thank you so much, Angela, for such an incredible conversation. I personally learned a ton, and now I'm incredibly inspired and going to Google my local university to see if there's anything interesting that I can be a part of. So I really appreciate you taking the time.
Well, thank you so much. And thanks to HITLAB for putting out such great content all the time for us to learn and grow from. Be well, and I look forward to seeing you on upcoming symposia.